Man,
Hey, I'm your nurse, Jennifer. I'm going to be taking a head to toe assessment of you today for your doctor. If that's what he's ordered. Do you mind if I touch you and if we do that assessment?
sure got it.
Okay. Can you verify your name and date of birth for me?
David Bowen, January 2nd, 1976.
Okay. I'm going to look at your ID badge on your wrist. Yep, David Bowen, 1276. Alrighty. I'm providing hand hygiene and patient privacy. Alrighty. Do you know where you're at today?
Yeah.
Okay, can you tell me where you are?
In the house.
Okay. Why are you here?
I'm getting a checkup.
Okay. And what year is it?
2022.
Alrighty. Patient is alert and oriented ×3 to person, place, time, and event. Looking at your physical features, you're dressed appropriately for the weather. You have no deformities. Your face is symmetrical. Your arms, legs are symmetrical. No deformities noted. You answer my questions, so there's no speech problems. Do you have any problems with your vision or hearing?
Vision ain't too great, but
Do you wear contacts or glasses?
glasses.
Do you wear hearing aids?
No.
Okay, so I'm going to start with the inspection. I'm going to start with your head, and we're all going all the way down to your toes. Your head is without any bumps. Hair is normal, no patches. Your ears are symmetrical to your face, from eye to the tip of the ear. There's nothing coming out of the external ears. Your face is symmetrical, your nose, your mouth. All right, we're going to do the eyes. I'm going to shine the light into your eyes, so just look at me. All right, now we're going to do a distance accommodation test. I want you to look over my shoulder. Now look at the pen. Look over my shoulder. Look at the pen. All right, pupils constricted and dilated. All right, your nose. Do you have any problems with your nose? Nosebleeds? No. All right, gonna look at the inside. They're pink. All right, put your finger up to one and blow out. There you go. Do the other side. Nose are patent. All right, now your mouth. I'm gonna do an oral inspection. Say ah. All righty, everything's good in there. All right, your neck is asymmetrical and no jugular vein distension noted. All right, now I'm going to assess your respiratory. Do you have any trouble breathing?
No.
All right. I'm going to be listening to 4 lobes on the front, 4 on the back, and 2 on the side. When you feel my stethoscope move, please take in a deep breath. All right. Right upper lobe. Left upper lobe. Left lower lobe. Right lower lobe. All right, if you'll take your arm and go this way. Deep breath. Other side. Deep breath. And that was the right and left lobes. Now I'm going to do the back. Alright, that was the right upper, left lower, right lower. No, actually, I said that wrong. Left upper, right lower, left lower. Okay, make sure. Patient is breathing normal, non-labored breathing. All right, now I'm going to teach you about turn, cough, and deep breathe and the incentive spirometer. So if you could turn your head to the, Take a deep breath and cough. Do the other side, please. That's normal. All right, incentive spirometer. We're going to pretend this is an incentive spirometer. So this is where you're going to breathe in. There's usually a tube at the end. You'd breathe in deep and then blow out and have the ball go up as high as you can to reach your goal. And this is there you go, to help with your lung function and breathing pattern. Alrighty, do you have had any head trauma recently? Alright, Glasgow Coma Scale is for head trauma. You are a 4 for spontaneous, 5 for conscious, alert, and orient times 3, and we're going to do your motor in a minute, but with you seem to be obeying all my commands, so you're 6, which would be no head trauma. You're good. 15 is normal, and 8 to 13 is possible head trauma, and 0 is unresponsive. All right, cardiac. I'm going to listen to your heart, and then I'm going to palpate and inspect for edema. And you don't have to take deep breaths. All right, second intercostal. This is the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And normally I would not be listening to heart sounds or lung sounds with a shirt on. It would be bare skin. All right, no murmurs heard. Palpate for pulses bilaterally. They're 2 plus strong, bilat. All right, I'm gonna test for edema. I don't note any edema in the upper extremities. Now if I can have your legs. I don't notate any edema in the lower extremities. Start with the feet, work your way up. No edema noted. Alrighty. I assessed the radial pulse. The posterior tibial is down here. Bilat, and then the dorsus pedis at the top of the feet. They're bilat, and then you would have the carotid, axillary, brachial, femoral, and popliteal behind the knee, outside of the 4 that I already said. Let's see, what else? No edema, no JVD. Oh, your cap refills of your fingers. All fingers have to be assessed. Cap refill is normal. All right, moving on to the GI, which is gastric, intestinal, or abdominal. Normally I would have the patient lift their shirt up and then assess the skin, inspect it, and look for any scars or moles or anything abnormal with the skin of the abdomen. And the patient would be laying down flat for the assessment of the bowel sounds, but we are just going to do it sitting up. All right, I'm going to listen to your bowel sounds. Start with the right lower. Right upper. left upper, left lower. I will turn my bell so that I can listen to the aorta, abdominal aorta. That is a normal sound, no brute noted. Okay, when was your, oh, nope, I gotta palpate the quadrants I just did. Okay. I started with the right lower, went to the right upper, then to the left upper, then the left lower, and back to the right lower. No rebound tenderness noted. Are you having any problems with your bowel movements or flatus, which is gas? Okay. When was your last bowel movement?
Today.
And when was the last time you passed flatus?
Today.
Okay, good. All right. Do you have any pain now to the gastrourinary system? Do you have any pain or burning whenever you urinate?
No.
And what is the color of your urine?
A little yellow.
Yellow. Okay, good. All right, to the musculoskeletal, I'm going to assess 2 joints of your upper and 2 joints of your lower. Just follow my command. All right, I'm going to assess the wrist joint. So if you would, point your fingers up. That's hyperextension. Now go out straight. That's extend and go down. That's flexion. All right, now back to extend. Spread your fingers apart. That's abduction. Put them back together. That's adduction. All right, now we're going to do it with some resistance. If you'll do those 4 things over again. Up. All right. Down. Good. I don't hear no crepitus. Okay. Good. Alrighty. Now for your legs, we're going to do the ankle joint. So if you, no, we're going to do the knee joint. That's easier. So if you could, put it back in regular position. Thank you. Now extend it out. One more time. Down. Back out. I hear crepitus. I feel crepitus. Okay, that was extended, and then flexion is backwards. Could you go? There you go. Thank you. All right, now the other knee, you could do the same. And back. Okay, heard some crepitus in that knee as well. Now your ankle. We're going to do the same thing. All right, if you could, point your toes up. That's dorsiflexion. Point them down. That is plantar flexion. I heard some popping. That's crepitus in there. All right, now let's do that with some resistance. Down. All right, up. All right. Crepitus noted in the lower extremities. Okay, now the last thing we have to do is assess your gait and balance. So if you could stand up, put your arms to your side, and walk heel to toe for me. Patient is walking in a straight line, no issues with balance. Okay, you can come back. All right, do you have any problems with falls or have any pain or stiffness in your joints?
No problem falling. A little bit of pain and stiffness in knees.
Okay, that is noted with the crepitus sound. All righty, well, I have got the assessment, and I will give this to your doctor, and he'll be with you momentarily.
Thank you.
Thank you.